Knock, knock, knock.
Come in.
Hi, my name's Erica. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Samantha, 7/29/1996.
Hi, Samantha. I'm going to do a full body assessment on you. Do you have any questions?
Nope.
All right, I'm going to provide privacy. And wash my hands before we get started. Couple of questions before we get started. Can you tell me where we're at?
Upper Valley.
And what month are we in?
January.
All right, I'm going to take your vitals to get started. Temperature. Wonderful, 98.6. Blood pressure. And while I'm taking your blood pressure, do you have any allergies that I need to be aware of?
Nope.
And any past medical history?
Nope.
Great. Her mood is pleasant and she is dressed appropriately for the weather. Okay, I'm going to take your blood pressure. Wonderful. 120/80. Your O2 stats are at 99% and your pulse is at 90. Also, your respirations are at 16. Any other questions before we get started?
I don't think so.
I raised the bed to appropriate height before I did her vitals. All right, starting at the top of her head. It is intact, appropriate hair, no lesions. Moving down to her ears, no secrum. Good. I'm going to test her eyes for perla. So if you can look, I'm going to shine a light in your eyes. Good. Her eyes are perla, which is her pupils are equal, round, and reactive. Now we're going to test her field of vision. If you can follow my light. Good. 6 fields of vision. All right, moving on. Her head is symmetrical with no lesions. If you could smile for me. Great. I'm going to look in her nares. Good. No drainage. And her nares are symmetrical. Okay, if you can open your mouth. Good. No redness or swelling. Tongue and teeth are all intact. While we're doing the face, we're going to do the whisper test. Cat, dog, mouse.
Cat, dog, mouse.
And then you're going to walk over to the other side and do the whisper test also. We are going to check her for JVD. You're going to ask your patient to lay down and sit back up. Go ahead, ma'am, the best you can. Great, no JVD present. Palpate her jugular vein, only one at a time. It's not bounding and it's within normal limits. Put your hands on her shoulders, go ahead and shrug. Good, no weakness. We're going to move on down to the chest. I am going to watch her respirations, which she's not struggling to breathe. Then I'm going to listen to her chest wall fall and rise. Okay, moving on. We're going to do your apical pulse. Listen to the 5 spots. And then the last one, you're going to listen to the apical pulse for 1 minute. Good. Your apical pulse was 89. Moving on to the lung sounds. Listen to the 10 fields in the front. Nicely assist your patient to sit up and listen to the 10 in the back. Thank you for taking a nice deep breath. Don't hyperventilate on me though. Good. Lung sounds seem within normal limits. Moving down to the abdominal or the belly. I am going to listen to the right quadrant, lower quadrant first. Then the left. Good. Bowel sounds are active. When's the last time you had a bowel movement?
Yesterday.
Perfect. We're going to palpate. Any pain?
Nope.
Wonderful. All right. Moving on. When you use the restroom, does it burn, hurt, or anything like that?
Nope.
Any hemorrhoids that we need to be aware of?
Nope.
Okay. All right, moving down to the lower legs. I'm going to inspect her legs, for dryness, if she has any bruises, lesions, and they look great. I'm going to ask her to push your toes up to the air. Good. And push them down. Wonderful. Check her pulses. Wonderful. Skin turgor. Good. And push on her toenail for capillary refill, which all was normal. All right. Now I'm going to go back up to her arms. I'm going to ask you to squeeze my fingers. Thank you. Good. I'm going to ask you to pull my fingers into you. Push them away. Hold on to my fingers. Thank you, ma'am. Let's check your pulses at the same time. They are equal. They're not bounding. Good. I'm going to check her skin turgor. You can check it here, or you can check it on her clavicle. Good. I'm going to check her capillary refill. Wonderful. Within normal limits. I am going to put the bed back down, tuck her in, and ask her if she needs anything before I leave the call light in her lap. Hope this helps. Have a great day.